Taylor. Back in October 2014, I was diagnosed with type 2 diabetes. At the time, I just thought it was fatigue, and it just got to the point where I was admitted to the hospital for a weekend for very high blood sugar level. On my discharge from the hospital, and met with Dr. Nikravan the first time, the plan was, I wanted to use a layman's term, kind of shock my system back to normal in the sense of very high doses of insulin and medications at the time to get me down to a point where I was at a more normal level from day in and day out level. And as we met after that, we were progressively changing my prescriptions and taking me off medication and letting me adjust my lifestyle accordingly. And when the results were showing really well the whole time, we kept tapering off the medication. Eventually, I want to say after maybe a couple of months, I was off insulin entirely. And it's just been, like I said, a phenomenal experience.
Management of type 2 diabetes has really exploded over the last 10 years. We are now using multiple pathway approaches towards managing diabetes. We're not just throwing insulin on top of blood sugars or lower blood sugars. We're understanding the mechanism, how diabetes, how blood sugar affects muscle, fat metabolism. We look at the muscle pathway, the fat pathway, we look at the liver, we look at the kidney, we look at the brain, the gut, the pancreas. We look at all special pathways along with the liver to be able to utilize all the drugs necessary by decreasing the resistance to insulin, by improving the insulin secretory benefits and preserving beta cell function, the cells that produce insulin, by changing their lifestyle, by changing their diet, by requesting them to understand what carbohydrate counting is to certain patients versus the glycemic index of foods, because you don't want to challenge your pancreas, as some of the foods that we have are high in corn fructose syrup and they are very high in glycemic index. So if the patient truly understands the dynamics of the disease process, we really incorporate a coaching method for those patients to really understand what they're doing and how they're doing this. And when they co-partner with us, it's a great way to manage those patients and they get great results. There's never been a better time to manage type 2 diabetes because we have so many new mechanisms of drugs that we're available that we just not have a decade ago. And we're so excited about that because it makes our job so much easier by creating less hypoglycemia, by creating less weight gain, by creating less problems associated with the management of diabetes.